We speak about aging as if it's a law of nature, fixed, inevitable, irreversible, but it isn't.
And it's a tragedy, and that we see almost on a day-to-day basis. People just accept aging, they accept cognitive decline, they accept losing energy, they accept losing functionality, they accept that pain sets in, they accept that they're going to put on weight, and it is, a tragedy is the right word. I think the misconception is it's in our genetics, okay? It is something that has always happened. It happened to my grandparents and my great-grandparents, so therefore it's going to happen to me. I mean, we're so fortunate now that we know and say we can actually start managing that aging process. You're the expert in the physiology, Johnny. Just tell us about it.
Well, aging starts really from 20s, 30s onwards. And how do we quantify that? How do we know that? Because when we look at metrics related to physical and cognitive capacity, we can see those start to change. If we think about some of the key elements related to muscle mass, strength, and VO2 max, so that cardiorespiratory fitness, with muscle mass, we see around a 5 to 10% decline per decade from the age of 30 to 70. But most importantly, that comes with a greater decline in strength. And at the end of the day, it's strength that we really want to focus on. If we compare our peak capacity in our 20s, 30s to someone in 70 or 80, that can be around about a 50 to 60% decline in strength. What we also see is a decline in these fast twitch muscle fibres that help to provide explosive strength, so that power that you take for granted when you're younger. We'd be remiss to not talk about VO2 max and cardiorespiratory fitness, so the maximum amount of oxygen that your body can use, your heart, your muscles, your lungs.
Johnny, it might just be important to actually put the numbers on there, because I mean it's something that we actually really tell all our clients about all the time.
Yeah, so to expand on that, VO2 max, it's the maximal amount of oxygen that we can consume per minute per kilo of body weight. What differentiates an elite athlete from a mere mortal is we are all breathing in the same amount of oxygen, but those elite athletes can use more. And we know that someone in the lowest category of VO2 max versus the elite or the highest is around an 80% higher risk for all-cause mortality, so risk of dying in the next 10 years.
I mean, that is just worthwhile repeating almost,
it's a staggering
isn't it?
Statistic.
You say, I mean, 80% difference in likelihood of dying. We're thinking cognitive decline, we're thinking heart disease, we're thinking metabolic problems, cancer, across the board. Okay, 80% difference in mortality over 10 years.
Yes.
Because you're not fit.
Yeah. And when we discuss it with clients, if we move from the lowest category to the second lowest, or from the lowest to the average, that gives you about a 50% reduction. And it will be, again, remiss of us not to focus on these metrics, explosive power, strength and fitness from an earlier age, because we want to focus on what are the metrics related to someone 10 or 20 years younger. We can be an 100-year-old that has the capacity and performance of a 70, that changes the game.